Who should run our healthcare system in America? Should Democrats run it? Should Republicans run it? Should the federal government run it? Or should the state run it? These are the questions being debated in the public policy realm recently, especially as we go to the new administration. With Donald Trump, he campaigned on the idea of repealing Obamacare. But in the early days of Obamacare, there was a call for repeal, way back 6 years ago. But then that call to repeal changed to repeal and replace. And that's what we have now, is a repeal and replace mentality. The question I would ask is, really, who is better at running the healthcare system? You see, the conservative pundits on talk radio would tell you we need the Republican plan. Of course, the liberals and the Democrats would tell you we need a Democrat plan. I'm here to suggest a third alternative. We don't need a Republican plan or a Democrat plan because, frankly, we need no plan. What we need is a free market in healthcare. We've developed a mindset somehow that government should run the healthcare system. Well, that's not the case. As a matter of fact, the more government gets involved, the lower the quality will be, the higher the price will be. And yes, maybe one party will be more efficient than the other. Maybe one party's ideas are a little better. But what we're debating about here is really not how to have the best healthcare system. What we're debating about in the public policy and in talk radio and on TV, we're debating about how to have a less bad system. Folks, we shouldn't be settling for less bad. America created the best healthcare system in the world because we had a private free market system, not one funded by government, not one controlled by government. We had a system where producers competed to produce a product, be it drug companies, be it medical supply companies, be it doctors and nurses. Consumers voted with their dollars and their feet. That's the system we need to go back to. And we've been conditioned into this binary mindset, a mindset that we have only two choices. We can either choose the Republicans or we can choose the Democrats. As a matter of fact, Wall Street Journal commentary, or not commentary, but article just recently quoted Paul Ryan. And Paul Ryan says it really comes down to a binary choice. Binary means two. Mr. Ryan said, this is the choice, and it's the only chance that we're going to get. You see, they're framing our choice so that we can have any healthcare system we want, as long as it's a government-controlled healthcare system. In the early days of the auto industry, Henry Ford was asked about color of cars and what choices the consumer had. Henry Ford answered. He said, the consumer can have any color they want as long as it's black. It's that kind of choice we're moving towards in our healthcare system. Pretty soon we'll be able to say we have anything we want as long as it's a government healthcare system.